Hi, in this video we'll discuss about the mechanism of aortic stenosis. Before going into aortic stenosis, we'll discuss about the normal physiology of heart. And this is the normal heart, and here we have the left atrium and the left ventricle. And between these, the left atrium and the left ventricle, we have the bicuspid valve or the mitral valve. The bicuspid valve has two cusps, that's why it's called bicuspid valve. And we have the right atrium and the right ventricle. Connecting the right atrium and the right ventricle, we have the tricuspid valve. Now we'll mainly focus on to the left heart. The left atrium gets blood that comes through the pulmonary vein and it will be emptied into the left ventricle, and from the left ventricle arises the aorta. So as the left ventricle contracts, the blood will be ejected into the aorta. And between the left ventricle and the aorta, we have the aortic valve, which is a semilunar valve. Now in this figure, you can see that the bicuspid valve is closed. We'll start from here. What happens is, as the blood from the pulmonary vein comes to the left atrium, the bicuspid valve is closed, and so the left atrium will get gradually filled with blood. During this time, the left ventricle is in a state of systole, so that the blood in the left ventricle will be ejected into the aorta, and after systole, the left ventricle or the interventricle enters into a diastolic stage, so that the pressure inside the left ventricle, left and right ventricle, we will focus on to the left side, so the left ventricle decreases. So what happens is, the left atrium is filled with blood and the left ventricular pressure is decreasing. So there comes a stage where the left ventricular pressure falls below the left atrial pressure, so that the bicuspid valve opens and the blood will be emptied into the left ventricle. About 70% of the blood from the left atrium will be emptied into the left ventricle, from the left atrium to the left ventricle, along this pressure gradient. And then comes the stage of atrial systole. Thus the atria contracts and the remaining 30% of the blood will be ejected or will be pumped into the left ventricle. Now what happens is, the ventricle goes into a stage of systole or the state of systole, and as you can see here, both the bicuspid and the aortic valve are closed. So there comes a stage, or at the initial stage of the ventricular systole, both the valves are closed, so no volume change will occur. No blood enters the ventricle, no blood leaves the ventricle, only the pressure will be increasing. That's why it's called the isovolumetric contraction. As the ventricle starts contracting, both the valves are closed and no blood escapes the ventricle, so the pressure inside the ventricle increases, and the pressure increases to such a level that the aortic valve opens and the blood will be ejected into the aorta. That's about the normal physiology of the left heart. Now what happens in aortic stenosis is that the aortic valve is stenosed. As you can see, the valve area is stenosed. So what happens? As the ventricle contracts, the blood has to go through a narrowed space or the stenosed valve, which of course takes a longer time. So here, as the ventricle contracts, the blood has to go through a narrowed space. So naturally, it will take a longer time and the output is fixed. So what happens? The left ventricle has to pump against a resistance. So naturally, it will get hypertrophy. And this hypertrophy is something like a concentric hypertrophy. That is, the size of the heart remains the same. The ventricular size will not increase, but this hypertrophy is towards the inside of the left ventricle. So what happens is, as you can see from the previous slide, the left ventricular volume will be decreased. So yeah, the left ventricular volume will be decreased, and now what happens is, the left atrium cannot empty completely into the left ventricle, which will result in increased left atrial pressure. So this will be transmitted towards the pulmonary vein. So this pulmonary vein is it'll go to the lungs, and since the left atrial pressure increases, the pulmonary venous pressure increases, and there will be pulmonary congestion. So this is the lungs, and there will be congestion. And with time, that develops pulmonary hypertension, the pulmonary venous hypertension, pulmonary arterial hypertension, both the pulmonary hypertension. Now, in case of right ventricle, normally the right ventricle gets filled with the blood that comes from the right atrium, and as the pressure inside the left ventricle, the right ventricle increases because of the right ventricular systole, the blood will be naturally ejected into the pulmonary artery, just like this. But in this case, the above mentioned the aortic stenosis, in the later stages of aortic stenosis, there develops pulmonary hypertension, so there comes a back pressure, so that the right ventricle cannot pump effectively against this resistance. So in a nutshell, what happens is, the because of the aortic stenosis, there is reduced output. The output is fixed, and also because of the concentric hypertrophy, the left atrium cannot empty completely into the left ventricle, so the output is reduced, and there is concentric hypertrophy. And because of the pulmonary hypertension, there comes a stage when the pulmonary hypertension overcomes the right ventricular pressure, so that there will be regurgitation, and because of the regurgitation, there will be tricuspid regurgitation also. So eventually the right heart will fail. And if someone asks what is the murmur, you see or you hear in aortic stenosis, it's the ejection systolic murmur because of the stenosis, and that will be heard in the aortic area. So that's all about the mechanism of aortic stenosis, and about its types, the types of aortic stenosis, the signs and symptoms and treatment we will discuss in our next video. Thanks for watching. Thank you.